Through a press conference held in Shillong on 3rd March 2022, the Office of the District Medical and Health Officer (Dm&Ho) Government of Meghalaya had created awareness amongst the general public on the mission Indradhanush immunization program of the central government. Those present included the Additional District Medical and Health Officer, East KHASI Hills District, Dr. SHIBBOLETH KONGLAH, the District Immunization Officer, East KHASI Hills District, Dr. KHARMUTI, and Paediatrician of GANESH Hospital, Shillong, Dr. IAINEH LYNGDOH MAWPHLANG. While speaking on the need for immunization of newborn babies till the age of 2 years, Dr. SHIBBOLETH KONGLAH informed that till date, the intensified immunization program in East KHASI Hills is only 66%, while according to the 3 rounds mission Indradhanush 4.0 intensified immunization for babies, the target is slated at 90%. Citing reasons like hesitancy and fear amongst parents to approach health centers, session sites and hospitals for immunization of their infants, Dr. KONGLAH said that the purpose of the Indradhanush mission is to leave no child without full vaccination against the 12 vaccine-preventable diseases like pneumonia, tuberculosis, tetanus, whooping cough, meningitis, polio, measles and others.
Kajingwan jungi mentakasngi kalong ba kadon kawe ka program kajong ka sarkar India kabaki khot commission Indradhanush kamba kiatip la bunsnam ngilale hamni hapo ka state kajongi but mentaka kantiru kaya lightly ki round laisien ka round ka ba ni kwa ba ngin yo lut ki khana baro ki bampat pendep ya ka routine immunization bakin one ban pendep ya ka immunization namar belai ngilai I bah ka ni kapor badan ka klam covid bon kilong kemi ladi kilong kapa ki artatien ban wan shi ki jaka ba I inject la ki dei ha ki centers ki health centers ki sub centers ne ki dei ha po ki VHND sessions ni ka nung ka session site ka ha ki shnong ki thau ki artatien ban wan ba kani jing artatien kala bu jing e shibon nakaliang jong tat ka ka kya ba hakadi ka kenti tentang lai tali ki district hapo Meghalaya ki bahap banle ya kani ka intensified mission Indradhanush ha ka ba ni bon kita ki drop outs ni bon kita ka hesitancy but ni don ru ki refusal hakini ki jaka ka pelong ba ka sarkar India ka lai ling ba ki performance ki jongi ling ba ki achievement ki jongi ba ngim kot sya kata ka thong na kata ka daw pengat biang yangi bingi hap banle kani no child should be left without vaccination dan I wei klung ru ibadai bangin banem yo ya ka routine immunization kajingwan kajongi hangni kalong bangi kwa man kentui ki me ki pala ni ki dong sumar jo ki khon ki ti khaptam ki badang kha do arsnam bakin wan ban pendap ban ai dei por ya ki ni ki inject ki banyadan ki khat arjat ki jingpang ida hangni Dr. IAINEH insa kham batai bnya ikini ki jingpang ki bani ki bam dan dawai hendrei dei tang da ka inject ka bala banyada ti gidon ladap sya ka round ke beningkong kata ka dei ha ka hinyau terik urempang ti menta bre na duk hinyau terik urber haduk khat sau terik ka dei ka round ka baal ban na du sau terik uyayong ka dei ka round ka balai ban bangi kmi lenti ba menta ngi dang dap kata bangi ong ka fully immunized coverage ka full immunized coverage kamut ka jing yo ji ki khlung haduk kata ka inject measles rubella JE ba ka PCV ki ba hapok khat berai lagi hapok shisnam hapok kan ka East KHASI Hills ka coverage jungi ka long tang 100% ti ngidan kam la kumnu ba nyo jing ya da ki khna baro khandai ko percent ni hab ban kot sha ka thong na ta ka daw kan di ka press conference le si ni la ban batai shai ki nong ngap ya ka jing dan kam ban pendap ya ki ni ki tika kadang ban yo ka jing ya da ban yo ya ka jing kot jing khia bat banem du ka jing im na ki jing pang bala ban ya da